Hi everybody, I'm Dr. Prathima A. I'm a consultant obstetrician and urogynecologist at Motherhood Hospital's Banashankari. Today I'm going to talk to you about a very common condition which has been plaguing women in this century. Guess what that is? It is the very common urinary tract infections, or commonly called as UTI. So why are women more prone to these urinary infections? Basically, the anatomy of women is like that. The female urethra is very short, okay, and it's very close to two openings which have a lot of bacteria which are the normal commensals in those spaces, that is vagina as well as the back passage or the anus. So what happens, because of the close proximity to these two places, urinary infections are far more common in women when compared to men. So now, what do we do? Do you worry if you get urinary infection once a year? That is quite common in women in reproductive age group who are sexually active. But we are concerned when you have recurrent urinary tract infections. When I say recurrent, I mean when you have 3 or more episodes in a year. So can we do anything to see if you are at risk for these infections? Yes. If you have any immunocompromising conditions like diabetes, autoimmune conditions like SLE, or any conditions which reduce your immunity, you are more prone to these infections. Diabetics more so are prone to urinary tract infections, and some of the diabetic medications also make you prone to these UTIs. Postmenopausal women, the skin and the urethra are all very thin and they are more prone to urinary infections. And young females are more prone to urinary tract infections, which get better with the immunity setting in. Now, what do? Usually you come when you have the sensation of burning, stinging, difficulty in passing urine, sometimes a blood-stained urine. It's very scary, but usually the initial, if you come, it can be treated very easily. We do a urine routine, sometimes we do cultures, and we treat it with antibiotics, and we make sure that it is resolved. But there are conditions where these infections don't go quite easily, they are recurrent, and they might need expert treatment for it. So that's about urinary tract infections. And the most important thing is maintaining a proper personal hygiene practices. Make sure that you have adequate hydration, and that itself prevents a lot of these urinary tract infections. Thank you.
Motherhood Hospitals. We care like no other.